Restrictions on blood donors, the unjust policies of the FDA. Background. The roots of limitations against gay and bisexual blood donors date to the HIV/AIDS crisis of the 1980s. This crisis affected specifically gay men. This ban at the time seemed preventative due to the HIV/AIDS epidemic, which lacked research, efficacious treatments, and faulty technology to diagnose efficiently. 3 decades later, in 2015, the FDA culminated the lifetime ban on men who have sex with men donors that was backed by several years of scientific research to a 12-month deferral. Donor deferral means that an individual is not eligible to donate based on the criteria used to protect the health and safety of both the donors and transfusion recipient by remaining celibate for a whole year in this situation. 5 years later, with scrutiny from the public and a pandemic with a blood shortage, the FDA reduced the 1-year deferral policy to 3 months due to the necessity. Since there is a blood shortage that is delaying and putting at risk other people's lives in part to a deferral that stigmatizes the whole community. LGBTQ+ and blood recipients are the most affected. It is said that 4.5 million Americans will need a new blood transfusion each year. Significance of topic. The American Red Cross says that the nation is facing its worst blood shortage in more than a decade, citing a drop in blood drives due to the pandemic. It says that at times up to 1/4 of hospital blood needs are not being met, and that 10% overall blood donations have declined since March 2020. The continuation of these donation deferrals for men who have sex with men not only limits the much needed supply of blood donors, but it also perpetuates the stigma that associates primarily gay and bisexual men with HIV. In practice, this is discrimination and all too obvious. For example, a heterosexual man can have high-risk sex for years and donate blood whenever. However, a gay man in a monogamous relationship who practices safe sex with his partner is barred from ever donating unless he observes celibacy for 3 months. Thesis statement. Despite the FDA's aim to ensure safe blood donations, the outdated policies hinder justice by discriminating against sexual orientation. Ethical principles in conflict. Beneficence. The concern of this governmental agency is to enforce the integrity of blood supply and ensure safety on the steps mandated before any biological product can be transferred to another human. The FDA has a policy to secure blood donation safety by establishing eligibility that can help identify certain risks in the process. Justice. This policy is discriminatory and prejudiced, painting the entire MSM community with a broad brush, and blood donations eligibilities are not applied equally, as one group is stigmatized for their sexual orientation. Utility. This deferral still gets in the way of the FDA serving for the greater utility of the citizens by jeopardizing at-risk patients in need of blood. This pandemic has caused blood drives to be canceled, and a decline in the number of people donating blood puts people's lives at risk and simply adds more cost and burden to a healthcare system. Importantly, blood donations should promote happiness and not be outweighed by the stigma that categorizes MSM donors as unsafe. These principles are in conflict because the U.S. has sophisticated screening methods in place that respects the beneficent principles of citizens, but the FDA still turns away blood donors because of their sexual orientation, while there's a clear critical blood shortage during the worst pandemic in a century is medically baseless and morally reprehensible. According to the American Association for the Advancement of Science, the Scientific Responsibility, Human Rights, and Law fosters and facilitates the responsible practice and applications of science in the service of society. The program addresses ethical, legal, and human rights issues related to the conduct and applications of science and technology. The program is committed to promoting high standards for the practice of science and engineering, advancing the human right to enjoy the benefits of scientific progress and its applications, engaging scientists, engineers, and the professional associations in human rights efforts, monitoring and enhancing assessment of emerging ethical, legal, and human rights issues related to science and technology, furthering the use of science and technology in support of human rights, and initiating activities to address the impact of developments at the intersection of science, technology, and law. This law relates to my topic because neurolaboratory assessments can very accurately detect the presence of HIV. So the FDA has a responsibility to revise policies that are outdated in order to fit in modern society without discriminating and respecting human rights. Resolution of the controversy. At a time when the nation is calling for unity and community, this policy rooted in bigotry is ripe for repeal. Excluding an entire group of people does not meet the needs of the U.S., not in a pandemic and not in pandemic times either. A potential solution is readily available to help alleviate some of the current shortage. Removing discriminatory and unscientific U.S. Food and Drug Administration restrictions underlying blood donation for men who have sex with men. Advanced technology is highly accurate with screening HIV. Technology that protects society from harm and that stands with solidity to the FDA protocols of beneficence. The chemiluminescent immunoassay test helps detect HIV antibodies and P24 antigens with very few false positive and negative results that are identified as an HIV infection, along with reducing the window period of infection. Another advanced blood testing practice is the duplex nucleic acid test that helps identify a window period in under just 3 days, and with the sensitivity and specificity of almost 100%. Pre-exposure prophylaxis is a medicine that helps prevent getting HIV from sex by 99%. That has been a popular prevention since its use, that has been increased along with increased testing and treatment, which has played a part in recent decreases in new HIV infections. The CDC estimates new HIV infections fell from 8% from 2015 to 2019. Solutions for the future. The FDA can dismantle the 3-month deferral from MSM donors and establish a just policy that does not discriminate based on sexual orientation by following blood donation individual risk assessments that other countries have set for years, while importantly prioritizing the safety of their citizens. Primarily, individual risk assessments are still tangible in identifying the possibility of risk for blood-borne diseases without medical jargons and with simplicity to all blood donors. Italy has had the individual-based risk assessment since 2001, and when comparing blood donor epidemiology from 1990 to 2010, there was no significant changes in HIV prevalence in either first-time or repeated donors. While in Spain, a study that was based off individual risk-based assessments as well, found that HIV prevalence in blood donors among first-time blood donors was 10.3 for 100,000 donors compared to the general population incidence of 10 for 100,000 individuals. This proves that individual risk assessments do not contribute to an influx of HIV infections through blood transfusions or donations, and that the FDA does have the possibility of switching to a new policy. Conclusion. Even though the FDA's blood donation requirements ensure safe blood supply to citizens, it discriminates on the basis of sexual orientation. Owing to the current blood shortage crisis, the FDA should eliminate the 3-month deferral for MSM donors to establish an individual-based risk assessment that proposes equality and importantly will be of greater utility for the blood shortage and in saving other people's lives. Since the HIV epidemic, the FDA has aligned sexual orientation with potentially bad blood, making blood donations policies in terms of deferrals discriminatory and inconsistent. Sexual orientation should not be a complication for gifting blood. Donation should be as easy as rolling up your sleeves for the greater utility of society. Thank you.